In this video, we're going to be talking all about lower body lift surgery. We're going to talk about who's a candidate, if insurance covers it, what exactly to expect around the time of surgery and recovery. My name is Dr. Saif Gallagher. I'm a plastic and reconstructive surgeon based here in Miami, Florida, and let's get into it. So, there has been an explosion in this procedure in my practice over the past few years. I think it's mainly because people are losing weight successfully on the new medications, the semaglutide medications, the Mounjaro, Ozempic, all of those. Because typically the most common patient who comes to me for this procedure is somebody who's lost a lot of weight. And when you lose a lot of weight, unfortunately, due to your genetics, or sometimes it's just unavoidable depending on how much you're losing, hand in hand goes with that is loose skin. So we all know about loose skin around the belly. Tummy tucks are very common, obviously, and usually we'll be combining this surgery with a tummy tuck. Very rarely we'll do it in isolation, but typically with most people's anatomy, we're doing a 360 lift. So we're tightening things up at the front, usually with the tummy. We're combining in liposuction. We're respecting the patient's gender. If they identify as female, we're usually creating curves or cinching in that way. So they're tightening the muscles. We can do other torso feminization procedures such as rib remodeling, stuff like that. If the patient is male identifying, we're going to want our hip to waist ratio to be a lot straighter. We're going to want an athletic look. We're going to want to reveal the abs underneath if their BMI is right for that. Keeping in mind that usually you don't see abs till about a body fat percentage of 12, so we don't want to make things look unnatural, but making that an opportunity if the patient is closer to that body fat percentage, or depending on what their goals are. So typically in weight loss patients, we're cleaning up all that extra skin in the front, but what the tummy tuck doesn't address is the butt and the outer thighs, and that's what the lower body lift does 100% address. It doesn't do anything for the inner thighs. If you have a lot of loose skin there, you may need a thigh lift for that, but it definitely helps with the outer thighs and buttocks and lifts things, improves the appearance of the buttocks, and also the thighs. In my practice, I don't do BBLs or Brazilian butt lifts because, in my opinion, injecting fat into the buttock area is pretty dangerous. Depending which study you read, up to 1 in 3,000 people die of that. So that's a little bit too much for me. I wouldn't have it personally, so I don't do it on my patients. There are lots of good surgeons who do it very safely. However, in my practice, this is the sort of butt lift we're usually talking about when we do butt lifts, and we get very nice natural results with this. So typically when we do this as part of a tummy tuck, it usually adds about an hour and a half to the procedure. I do it drain free. I'm not just skipping the drains. I'm doing what's called progressive tension sutures, so I'm closing down that dead space on the inside. It may help with the scarring as well, but you are going to have a lower scar across the lower back, and scar care after this is very important. But like I said, it tends to be pretty forgiving around there. Usually it doesn't add much downtime to your tummy tuck. Like typically most folks who have a tummy tuck take about 2 weeks off work, usually depending of course on what their work is, and about 6 weeks off heavy lifting and working out. Most folks, I don't notice much of a difference when we add in the body lift to their tummy tuck. They have about a very similar timeline, and it also tends not to add a lot of pain to the procedure as well. We keep the area as numb as possible. Overall, it's one procedure that is a game changer to many people. It makes them look a lot more athletic, a lot more natural and contoured in the buttocks, the lower back, and the thighs. I hope this video helps you understand body lift, and I have another video about body lift versus just tummy tuck, how you decide on that. You can check that out. It's here on YouTube. Otherwise, we're accepting consults at our practice here in Miami. Usually when patients come in for this procedure, depending on their medical issues, they're about a week with us here in Miami. But I hope this video helps with your understanding. One thing I forgot to add into that video, which I kind of overpromised on, was that I talk about whether or not insurance covers this. Typically, unfortunately, it doesn't. Usually, this is considered cosmetic, and I've never seen a case where it's covered. If a patient has a lot of functional problems, they're getting rashes because of a lot of extra skin there after weight loss, maybe it could be, but unfortunately, usually this procedure is not covered by insurance.